Now all new at 5:30, the Princess Anne area of Virginia Beach is growing so quickly. The 5-year-old hospital there is already bursting at its seams.
Yeah, Sentara is now working to add more beds to meet that demand. Earlier today, I sat down with the hospital president, Thomas Thames, to talk about the $35 million expansion.
This 5-year-old hospital, like a 5-year-old child, is growing up, literally. And like a proud papa, President Thomas Thames showed us and told us all about it.
But we have outgrown the 160 beds. We've held as many as 27 patients in the emergency room awaiting a new bed free upstairs.
That's frustrating for patients and staff.
It's difficult for us because we know that we're not providing the level of service that they would like.
This open room, we're told, is rare. Dr. Thames says almost every day, every bed is filled.
It's the baby boomer aspect of we're reaching that age where we're in need of more medical care, and that care typically still requires care within the hospital.
The expansion, he says, would get patients the care they need. It calls for 2 stories. One would be fully built right away with 14 new patient beds available and the potential for 10 more in the future.
We are in the growth corridor. We can anticipate, perhaps within another 5 years, the need to expand again to meet those needs.
The current growth chart calls for construction to launch in February. And while this busy ER will likely continue to feel some growing pains through the process, relief is expected to come when the first patients are put in those new beds the following March.
Now, all of those plans hinge on approval by the Virginia Department of Health. Sentara has applied for a certificate of public need for this expansion. But as busy as this hospital is, Dr. Thames says he sees no problems in getting that approval.